A little bit nervous if it works. Yes, we're on. Hello, good morning to the Netherlands, good evening to Australia, and good afternoon to Bangladesh, and good day to the rest of the world. Welcome to another day of the International Days, and today we have a session in which we will have a conversation with Salek and Simon. And we're really hoping to dive a little deeper in physical activity for mental and physical health in the context of displacement, and especially concerning the experiences that both Salek and Simon have had or have still in Cox's Bazar in Bangladesh, with vulnerable populations, with displacement. What does it mean for all healthcare professionals? Welcome, definitely for Simon and Salek. Really good to have you here.
On mute. That was a good start. Thanks for the invitation, Joost. I'm looking forward to the discussion.
Thank you. So it will be really good. So can you tell a little bit about the project, about what we're going to talk about? Because you have way more input together with Salek than I have. So that would be great.
Yeah, sure. So I guess what we're interested in talking a bit about is the role of physical activity within context of displacement. So particularly in Bangladesh, we're talking about the Rohingya refugee crisis, which is currently one of the biggest refugee situations in the world. There's close to, or just roughly 1 million refugees living in Bangladesh. Now, Salek is far better placed than me to talk about that context, and he lives there and is a psychologist. I'll let him introduce himself, but he has got a lot of experience and also research experience around physical activity, and that's partly how we met. And my interests lie in physical activity and trauma, and how physical activity and exercise can be used to help vulnerable populations, particularly those that are experiencing trauma or PTSD or other mental disorders.
Great. This makes it directly already interesting. And then, as you say, Salek, could you introduce yourself based on what Simon says? So then we get a little bit deeper into who you are and towards the experience.
Okay, thank you everyone for giving the opportunity to speak. So my name is actually Salek Ahmed, and you can call me Salek. I have completed my graduation and post-graduation in psychology from Dhaka University, which is one of the famous university in Bangladesh. So during my study life, so I had an experience to work with the child mental health under a research project, which is led by the IOLO. And then I have an experience to work with the Apollo Hospital as a volunteer to maintain all those the counseling at the home level to assist the counselors. Apart from this, actually, when I finished my studies, then I started my career with the humanitarian context. I started my career with the ACF, the Action Contre la. It's a French-based international organization in the mental health and psychosocial department. So one of the key job is to promote the psychosocial and mental health well-being among the refugee community. So we did a lot of intervention, and one of the intervention is the physical activity and sports, which is very related with their cultural things. And we also respect their cultural things. We also promote their cultural sports and games throughout the intervention. So it is totally the community-based mental health and psychosocial approach. So, and we have actually the uh, two types of intervention uh, based on our actually one is the curative part and another one is the preventive part. Actually the curative part, the intervention is facilitated by the in the facility level, the primary health care and the health post, and the community level actually we do some community based awareness sessions, we do some community based sports program, activity program, which actually help them to understand the mental health well-being, and too important is also important for their self-care so that they can protect themselves from any mental health illness. So currently I am working with the UNHCR But before UNICEF, I was with the IOM, the UN Migration Unit. So, and before that, I was in Oxfam. But in every phase, my responsibility was to improve the mental health and psychosocial well-being of the vulnerable community. So, through sports and through different physical activities, we try to build their uh, like the coping skills, and we also fostering some social connections between the host community and the refugee community. So this way, actually, we're trying to mitigate the mental health illness and also improving the mental health and psychosocial well-being of this vulnerable community. I mean, the Rohingya community. So this is from my side. If you have any further questions, so you can explain. Thank you.
Oh, thank you very much. This is quite a lot of things. So if we want to say, you mentioned so much in so little time. This is something that we really like to pick on a little bit more. So first of all, thank you very much for sharing your experiences. I must say I'm a little bit flabbergasted by what you just told, and I have to kind of dive it into it a little bit.
Yes, there's a couple of things that if I could just jump in, I know that just having
Please.
a bit of experience, because there's so much that Salek just explained there, and I have to say that Salek is an amazing person. I've been really fortunate to work with him in person and now from a distance. But as a psychologist working this area, he has so much experience to share. Salek, a couple of things that you mentioned there that I think are really interesting that were interesting for me when I arrived in Cox's Bazar. But one is the impact on the host community. And we don't often hear about that. And also the potential for sport to play a role for social cohesion. You touched on that. Do you think maybe you could just explain a little bit more about that?
Okay, just in this case, I'd like to share the experience when I was in the Oxfam. So our program is actually to improve the social connections between the host community who are also affected by the refugee influx. So actually the after the influx, the host community also face some difficulties, which is affected their mental health and psychosocial well-being. For example, this is the largest camp in Bangladesh, and most of the people who are the host people who are living in the Ukhia and the Teknaf Upazila under the district of Cox's Bazar. So these two areas actually the most the refugees are living, and the people of the Teknaf Upazila and the Ukhia Upazila are suffering a lot of problems, like the price of the goods are high actually, and they have a very limited income source, and also the administrations have also some restrictions. For example, the fishermen cannot uh, catch fish in the river because it is the border area of the between two countries, so they strictly forbidden for the fishermen to catch fish in the river, so that there was no actually communication between the Myanmar and also the Bangladesh. So all those things actually uh, created sufferings among the host community. So we are also trying to help the host community on behalf of the agency to promote their wellness. And there is some problem between the host community and the refugee community. There is a tension among, so because as they are living very closely, and sometimes they are actually the host community feels that they are deprived because some of the facilities given to the refugee community, but they are not getting. So these things actually we try to mitigate it through a different event. So one of the event was the fair, the Eid fair. Actually, the both of the community are the Muslim, and we try to increase the social cohesion among them. Actually, it was held in the Tekna, where the refugee and the host community are living together. Actually, so in the fair we did some sports activity actually, like traditional sports activities of the host community and also the Rohingya community. So we try to actually connect or make a good relationship between the host and refugee community. so that we can avoid like the social community conflict or the violence. It was happened like sometimes. So through this sports activity, we try to actually build the relationship between the host and refugee community. We also give some materials, sports material. For example, the cricket is very popular in Bangladesh, so we buy some cricket materials for them. And we also, in the Rohingya community, have some popular game, which is called the Sellu. It's like the volleyball. You can play with the, it's not volleyball, it's handball, like maybe. Uh, but they play using the leg, not the hand. But the other things is so it's very nice, and the people are enjoying very much actually. And we also do some
It's
competition.
a pretty amazing game. Sorry, Salek. It's a
Yeah.
pretty amazing game. It's called Chinlon. So it's like volleyball, but with the feet. And it's absolutely incredible to watch. It's one of the most athletic sports I've ever seen. Sorry, Salek.
Yeah. Thank you, Sam. Another thing, we also do some sports match. It's not a competition actually. It's building the communities relationships, and also putting them in activity. Actually, when they were in the Myanmar, they have a lot of physical movement, but when they're in the camp, actually their movement is very restricted by the government and all those other things. And in the refugee camp, they have a very less space to do any kind of physical activity or any kind of the sports. So most of the time they spend very ideally in their sheds or the tea stalls, but we try to make them more uh, active through these sports and try to engage them actually in our the interventions. And through the different community consultations, we designed our program actually so that the community can own it. So as far as this is from my side actually, what I.
Thanks, Salek. I'll hand over to Joost if there's any other questions.
Yeah, I was just thinking, because this, I have to say, normally you definitely brought it up from different perspectives directly here. So if you say the impact on the host community and what's actually there, then you see directly the complexity, and Salek, what you mentioned, and that's how you build in this good prices go up, resources, limited things. The thing what I really liked is you talked about host activity. Isn't it? You talked about that it's quite important that people needs to bond. Was there an openness from both societies actually, or how did it move that? Because I can imagine also the barriers or the restrictions, so that people feel from, okay, we don't go, because that's what we see sometimes in Europe.
Sorry, can you repeat it? Yeah.
Yeah.
I think that there's a bit of background on your end, Salek. I'll try and summarize for you and let me know if this is capturing the question. Salek, I think just asking more about the social cohesion comment. So you mentioned about we're talking about the impact of the crisis on the host community. You talked about the loss of livelihood. Were both sides willing to engage in the sports programs?
Okay, we did actually the meeting with the community people. So when the crisis happened, the both community actually, from the Rohingya and also the host community. So based on the discussion and the suggestion actually from the both community, we arrange it. So how can we actually living peacefully in the same area? So this is the suggestions comes from them actually. And what we found that especially the young children actually who didn't have an opportunity or didn't mixed with the Rohingya communities, we find very positive feedback from the children and not from the adult, because still we need to mitigate some issues, these things. So still the problem is there, but we are trying to actually improving through different kind of the sports in game actually. So the impact of these sports on the children is very good, but adult we need to actually do more because we had a very limited opportunity, and we have also some restriction from the administration side. So this is the actually, but we are struggling actually to improve it.
Salek, can I ask you a question here? Sorry, we know from your research, Salek, and also work that we have done, that really when we think about sport, the people in camp who have access are often able-bodied young men. You know, we organize the soccer tournaments, the soccer games, but we know from the evidence that actually if we could engage women, if we could engage people living with mental illness, people living with disability, we have far more potential of actually having an impact. But yet at the moment, as you mentioned, there's no resources available. Can you comment on that, on what you think, you know, the opportunities are in terms of engaging other people beyond able-bodied young men?
Yeah, there is actually a lot of opportunity, but the problem is that the community actually don't focus on the physical activity. So the importance of the physical activity is more important. They don't understand actually. So we need to actually do some awareness raising. Already we are doing, but still we need to continue it. These things. And regarding the mental illness, already I mentioned that we have some the sports activities and only physical activities in our the primary healthcare units. So through the different implementing partner agencies, we are doing some exercise activities with the NCD patients actually. So it is still we are doing it and try to see the impact actually. So it is still under process actually. So without these things we cannot say actually anything. So we are still doing this.
Salek, it might be helpful for everyone. I know you have published work looking at the barriers to the community. Can you just talk us through, you know, you mentioned space, but can you just talk through some of those barriers that are there for people to engage?
Okay, the one of the problem is the space actually. Though we are motivating the administration to give some recreational space so that we can do some sports activities there, and we also suggest some activities they can implement in their house level, in the shed levels. And another point we feel the barrier, the women actually, they are the rest, I mean the conservative community, so they didn't allow the women to go outside and all those kind of physical activities. But in the UNHCR, they have a true register campaign. So we have some program, like in our the last what we mentioned in the articles, that we did some the badminton competition among the women and girls. The badminton court is covered by the fence and also the clothes so that the man cannot see it. So the women can easily go it and play those all kind of. In this way, we try to respect the community's perceptions, and we also maintain the sports and the physical activities for the women and kids, the girls actually.
Salek, can you maybe just explain a bit about in the camps what the women-friendly spaces and the child-friendly spaces are? It might not be familiar to everyone on the call.
Okay, there are actually this is implemented by the GVV unit. So there are some program under GVV, the gender-based violence. So women-friendly space is run by this actually the unit. So the men are not allowed to go there. So this is mainly for the female participants. So they have a lot of recreational things like the different indoor games. Which is traditionally acceptable, and they have also some different livelihood training and skills like the sewing. So they have also some discussion. The peer discussion is there actually. And in the child-friendly space, we have. I have an opportunity to visit. So there are a lot of child play is there, materials is there. This is implementing by the child protection unit actually. So the sports is actually there, but not actually like the physical movement, all those things. And they are playing some materials like the toys actually, but physical movement is not what we think actually is not there actually. So it's very limited, but the community are used to sometimes they get any space, so they try to use as an sports actually. And another thing, actually, we also appreciated there are some activities under the physical activity, like they are taking the water, because and they are also living in the hillside, so they need to cross a lot of long way to catch the to collect the waters. So we also appreciate it, and they also have some traditional religious like the prayer. So it is also movement, the physical movement is appreciated. Because sometimes they also give feedback that when they pray, when they walking from on this distance, it helps them to improve their actually the emotional health, to feel good actually. So we also praise and also rewarded them actually, so verbally. So this is the things.
Oh, this definitely gives a little bit more of an idea. I really liked it when you talked about respecting the conceptions of people and talking about traditional, acceptable, women-friendly space, child-friendly space, which of course is quite difficult actually to build up in a place which emerged like a camp. To my opinion,
Yeah.
I think that when I look at most of the people around me here, or with probably listening from at least from the Dutch or Norwegian perspective, I actually don't think that they have a clue what we talk about. Can you, Salek, is it possible that you provide us with a little bit of an idea about the environment that people live? Because I think that we can't actually imagine this one.
Okay, thank you. Yeah, there are 1 million people living in the like the 5,000. Uh, I don't know the actually the word. Okay. It is better to explain like the 8 people are living in the 10 to 10 feet square room. So this is their actually the capacity. So each shelters. So you can the 8 people can be the 100 square feet room. So this is the shelters, and there is a very congested area. So it is. If you go there, so you will see just only shades and shades and camps and camps. It will difficult to see any tree in the hill area. So because most of the hill area are covered by the shades, and thanks to Bangladesh, because they are giving the space actually for this refugee community. So yeah, it's really difficult to live in a tiny room. Yeah.
In addition to the crowding, I think something I can just add is that region of Bangladesh. So Salek mentioned the Teknaf and Ukia, the Upazelas, and Upazelas is like a suburb or a region. And those two regions, Teknaf and Ukia, are quite, they're extremely poor regions of southern Bangladesh that have now been, they've added the burden of nearly 1 million extra people. And so that as well creates the tension. So it's not that suddenly you're in the camp, as you drive through those regions, they're extremely poor regions as well. And then the camp is there. So it's sort of adding an additional resource burden to an already, compromised place. But as Salek said, it's difficult to explain. If you're standing there on the hill looking on the horizon, all you can see is these semi-permanent structures. But the overcrowding and thinking about things like even using a toilet facility, latrine, in that overcrowding and the issues that can create for the community as well.
Thank you, Salek and Simon. I think this is really helpful, at least to have a kind of a picture what it is. So if we talk about an area that it's limited of resources for the people, they have a hard living, and then 1 million people, as Salek, as you mentioned, it's really great from Bangladesh that they provide space to these people, but at the same time, then you have the resources and the crowdedness, and it's a different, so you have to emerge in a different social cohesion with each other. But you managed to find spaces like the women-friendly space and child-friendly space to actually have sports activities, which is, just to give you a little bit of an example, I'm living in the Netherlands, which is as flat as a pancake, which is, it's nothing, there's no hills. So the highest hill is 100 meters, which is not a hill, it's just a bump in a flat land. So for me to think about having everything and also with sports activities in a hilly side is something already from an, well, if it's empty, it's difficult, but now we have more in a vast area of people also. But that means also that space has to be created in a safety that people can move there. Was that difficult? Because I can also imagine that there's also some barriers to make that necessity, because it sounds like when you talk to me, when you talk to us and you bring us on, we want to make it as easy as possible, and actually that's mostly from a policy department. But actually what you now say is concerning social cohesion, mental and physical health. You need to create spaces where people actually can meet. But I can also think about this is the difficulty to start with.
Yeah, what you said mentioned that when the influx is happened in 2017, so during this time it is really difficult to manage all those things, because there was no road and all those things. In the rainy season it is very difficult to go high hill area and to provide the support to the beneficiaries. But the different agencies we will also recognize their contributions actually, who are the different international national agencies also doing a lot of hard jobs to make the road, and also the government also helps in preparing the road, so that the service provider can go there and help the beneficiaries. So through this way, now the situation is little bit more better than compared to the 2017. So because the road is now, though it's not actually the permanent road, it is used on the bricks, and we also did some uh, uh, like the semi-permanent roads actually, so that the refugee can use this road and to come to the facility and get support from the facilities. And sometimes the governments, with the permission of the government, some hills area is also cut, and to put some centers like the child friendly center, hospitals, all those things actually prepared. And yeah, there are some plain land between the two hills. So sometimes we used as the sports area, but it is actually for seasonal actually. Like in the rainy season, you cannot use because water is storing here. And another thing is that sometimes this field actually used for the crops. So during this time, there was no sports. For example, what we want to mention, when I was in the IOM, so we organized a sports match, but we cannot continue the full sports because we get sports for the 1 month, but we need actually more than 1 month. So that's why we need to limit the time of the play. We need to limit the sports team member, also the group. I mean the number of the teams. So we're trying actually through this way.
Salek, can I just ask you a question there? I mean, we know the evidence around what happens when people become inactive, and how, the relationship between how we move and how we feel, and the evidence is very clear when we take exercise away. And I think it's particularly relevant at the moment with COVID in every part of the world, with lockdowns and all sorts of things. But I know when I was in Cox's talking to some young men in camp who had lost access to their field, and it was such a significant issue for them because they couldn't play anymore. I mean, can you comment on that from your experience, what you've seen when the community loses access to the ability to move and participate in sport and activity?
Yeah, actually, what I mentioned earlier, that we did the community consultation. So the findings of the community consultations that especially the young children who are below the 18, and they have nothing to do in the camp areas, so they feel actually very bored, and also they're doing some the activities which is totally the antisocial activities like teasing the girls and the women's. So all those things, the negative social behavior, they were engaged. So then what can we do? We also seek the suggestion from them. So they suggest if we are able to play some things, if you can manage some materials, that time, okay, what kind of play that you want to do these things. So then we arrange the football match and all those, the physical movement games like the silung games, the badminton, all those things. After that, we did the another focus group discussion with the community at the same time. So from these findings of the focus group discussions with that people, so they are less involved in those negative behavior actually, and yes, and they also receive some positive feedback from the also the CIC, the campaigners regarding their behavior. So yeah.
Salek, I think that's a really interesting point. So just to essentially what you're saying, we talk about outcome measures associated with physical activity, but one thing we wouldn't think about is antisocial behavior. And I know that even aspects of the UN are looking at the impact of sport on de-radicalization in certain contexts. So I think what you just mentioned there is actually a really critical issue and something that we don't really give enough attention. And essentially what you're saying and what we know is that there's groups of we have lots of young men with absolutely, very limited opportunities to engage in anything. There's high rates of gender-based violence. There's high rates of social issues, and actually activity and sport is one likely way. It's a community identified way of actually trying to alleviate some of those issues, but probably just not getting the recognition or resourcing that it needs at the moment.
Yeah, absolutely. What is mentioned that thing. So we also try to understand their mental health, and they have some uh, during this time actually when I was I'm doing some physical activity. So we also received some positive feedback from the children and also the women, especially their sleeping problem. So after the physical activity and all those things, it is improved actually, and they have also some feel energized. I mean that they get energy to do thing more, which is received from the women group also. So this is the findings I received from the focus group discussion with the community people regarding the physical activity and the sports, what we did in the last year actually.
Thanks, Salek. And I'll just, I can see one of those questions there, just about trauma and physical activity. So just building on what Salek just said from his research and also in the research that we did, one of the big things that we found was even among the women, they talked about activity being a way of dealing with what they were calling as tension. And tension is essentially a local idiom of distress that encompassed depression, trauma, and stress. And really, it was again a community identified way of processing that and dealing with that. And we heard examples of women in one of the camps, for example. Sorry, Salek, I think you've just got a bit of background noise behind you there.
Sorry?
No, there was just a bit of background noise. It's all good. I know it's probably busy where you are. The women would talk about waking up in the morning and going on walking groups together before the men were awake, which was quite amazing for us to hear about. And again, they did that because of the social connection and the meaning and that ability to relieve that tension.
Once you drop it, just inform one of them.
Yeah.
Salek, if it's okay, we might just get you to chuck it on mute while there's people behind you.
Okay, now it's fine, I think. So, okay.
Joost, over to you, I think.
Okay.
Yeah, thank you. We got some questions in between, but first of all, I thought, Maria, did you have a question?
Yeah, thank you. First, I just want to say it's amazing to listen to this work, and have also been following what you do. But I think it's very, as also Joost commented, it's for us that have not been in such a camp only seen pictures of the tents, it's very difficult to understand the situation. I think it's impossible to imagine. So that is one part, and I'm very impressed of how much that is still possible to manage, and it's inspirational for us not living in camps like that, because we are also making a lot of problems that we don't have. So that is one thing, it's kind of a reality check on our life sometimes. But I was also thinking that I think it's very transferable what you do there to our communities too, because it's using sports as such a multi-tool for both personal health and for social problems and for against radicalization, and I think we can learn a lot from that to look more at that responsibility of in our communities also, how we can use this as a tool. And then I was just thinking of because I know that refugee populations living here, for example, also have the challenge of being active enough, and also they mention the lack of place for doing it, especially those that live on the before they get proper housing, and a culture question has been asked there also, how to manage to include everyone. And this became a long question, but is gender the major kind of cultural aspect we need to take care of? That was two long questions, but did you understand what I meant? Is that the main thing we need to think of when creating opportunities for everyone to be active?
Oh, I might go first, but Salek, obviously you're far better placed to answer this. I think gender and religion are two of the massive factors. They intersect as well. And I think what Salek talked about co-creation and actually talking to the community is really important. I think when we're designing a program for any community, it's important that they have agency and they're involved, and we consult. We don't just assume that we have the answers. I would say that I think one of the interesting things about sport is that it's entirely transcultural. It breaks down barriers, it crosses cultures. If you give a child a ball, they're going to kick it and they're going to look for a friend to kick it to. It doesn't matter which part of the world they're in. That's just human behavior.
Yeah.
So, but Salek, I think religion in particular, it would be really interesting if you want to comment on that maybe as well, and the gender issue.
Yeah, thank you, Simon. Just what you mentioned that I already mentioned, this community is a very conservative community, so the women actually not allowed to go outside. And this kind of exercise and physical exercise, they have their negative thought actually. So in the last they have some misconception about the physical exercise. They compare it with the dance, because it is also related with the religious belief actually. So when we are promoting this kind of physical activity and sports, so they have some negative thinking about this behavior, and it comes from the religion actually. Because when I discuss with the religious leaders, so they say this is not actually the women activities, the women should keep in the house. So we need to also mitigate these issues. And what you mentioned, the gender actually. So already I mentioned that we have the women-friendly space and the child-friendly space. We try to involve and engage more women in the different kind of the interventions. And one of the interventions is the sports and physical activities. What you mentioned that we covered the full playground so that women can easily access to the playground. And we also give them some materials so they can play. So through this way, actually, we try to the balancing actually the gender and the religion. Did I answer your?
Yeah, thank you very much. And I think also, I think it was a good answer. And I think also what you mentioned about or you, Simon, mentioned about the using the work. This is okay. We're working to get water and finding meaningful activities for everyone, whatever that could be. If that is a key for for all communities, maybe for some it's meaningful to run, for some it's meaningful to do work, and if that is also a key to success there.
Yeah. Because when we compare the life, actually the active women who are doing and who are not active, who are passing most of the time in the household area. So based on our experience, that we found the active women who are actively engaged in this kind of physical movement, their sleep problem is not there, their concentrations and energy is also there, compared to the women who are in the living in the household in the area.
Can I continue with one more question? Maybe that pops up. Have anyone? I mean, you have a very nice experience now from your work. Is this also transferred to other camps and have it been tried in the same way? Do you know that?
Sorry, what is that?
If you know in other camps, in other refugee camps, if your experience have been used for increasing activity in other places, do you know if that has happened or?
In other places mean the other country or?
Yeah. Is it getting a kind of a movement of?
Maybe I can jump in there, Salek. I think there's a lot of increasing awareness within the what's called the MHPSS. That's the acronym, which stands for Mental Health and Psychosocial Support. And I think within the MHPSS world, there is increasing recognition that actually physical activity is a mental health intervention. It's a mental health strategy. Another great example is in Lebanon, in the Bekaa Valley. There's a great NGO called ClimeAid that has built a semi-permanent or a permanent rock climbing wall in the Bekaa Valley in a refugee camp there. And they're using rock climbing as a mental health and psychosocial strategy to again build social cohesion, improve mental health, improve physical health of the community, and more recently they're doing work in Beirut following the blast. So I think that's a fantastic example, and there's pockets of that everywhere. Another great example is Skaterstan, an NGO that uses skateboarding in places like Afghanistan and Cambodia to engage children. There's a great TED talk by the founder of Skaterstan that I'd encourage everyone to watch. But really, it's those common links that sport crosses boundaries, it crosses cultures, it engages people, it offers a pathway. It offers a pathway into more traditional healthcare, mental health care, education, all those factors. So I'm really optimistic about where that field is going. And I guess another piece of work that's happening is the Olympic Refuge Foundation at the moment, which is under the IOC, has a think tank on sport and humanitarian contexts. And so it's great that there's a lot of progress happening there around really developing resources and trying to understand how we can best utilize physical activity and sport in these contexts.
Thank you.
Can you guys hear me? Yep. I actually have a question for you, Simon. I'm very curious as to how you got involved as someone who's from Australia, how you got into Bangladesh and how you met Salek and how you guys started working together and what were like the main drives, the main story behind setting up the project. I'm very curious about your experience.
Yeah, sure. So it's all been an interesting journey for me. I think I started by accident at a psychiatric hospital here in Australia. Purely by chance, got a job there, and that was working. So I was working mainly in the PTSD unit. So I spent 5 or 6 years working with mainly veterans and emergency service workers, and I was working as an exercise physiologist. So providing exercise services to these inpatients. And that was where I did my PhD, because I was really interested as to, basically the patients just kept saying the same thing, which was, exercise for some of them was keeping them alive. And it was as simple as that for some of them, not for all, but for some of them. It was just such an important part of their management and what they needed. But when I looked into it, there was no funding. It wasn't recognized as a treatment. So they couldn't access funding for gym memberships or whatever it was. And that was how I ended up enrolling in a PhD to try and generate that evidence. So we did a randomized control trial looking at what happens when we add exercise to usual care for inpatients with PTSD. We published that, and then I sort of did a lot of work in early psychosis units and other inpatient settings and community settings, but really all around this idea about promoting exercise for people living with mental illness. And then I was fortunate enough to be sitting at work next to a colleague, Dr. Ruth Wells, who is a refugee mental health expert. She did a PhD in Lebanon with Syrian refugees and has done some fantastic work. And we just got talking about, look, we know this works in high resource contexts like here in Australia, but what about in more challenging environments or less, poor resourced environments? And we together we went over to southern Turkey and did some work in Gaziantep with an organization over there who were providing mental health and psychosocial services with Syrian refugees. And again, we just had a similar positive findings where we could just see that this was such a critical part of the community, but just something that we weren't recognizing, and it's underutilized and I think under-promoted, despite the fact that it's a basic human need, I think. And it kind of challenges this idea that exercise is I would say here in Australia, exercise, and probably the same in where you guys are, it's a privilege. It's a privilege of those that are fortunate enough and have the social capital and have the support and have the resources available to engage in exercise. So we keep, we run these public health campaigns telling people to get 150 minutes of activity a week. But what about people who don't have access to footpaths, or who don't live in safe communities, or don't have child support, or don't have shoes? I mean, why are we telling them to get 150 minutes of exercise without finding ways to support them to actually change, the break down those systemic issues and the barriers that they're facing? I'm getting off topic here. So then we did the work in Turkey, and then when I was over there, that was just after the peak of the crisis in Bangladesh. So I was kind of watching it on the news, and I was really interested in this idea that, look, it seems to work, or it seems to be an effective part of, rich countries and people managing. What about in these contexts? And that was how I first ended up going to Bangladesh. My first time there, driving through the camps, what really struck me was seeing kids with absolutely nothing kicking basically garbage bags around as a ball. And so again, but the resilience and the happiness as they're doing that, and just showed me again why this is actually so important. People need meaning. People need purpose. You can provide shelter, you can provide sanitation and hygiene and food, but actually people need some meaning and they need some connection. And sport is one of the cheapest, simplest, most scalable things that we can do to actually provide that to a vulnerable community. A long wandering answer. I'm sorry, Max.
Yeah, no, amazing. Very fascinating story. And how was it for you when you traveled back to Australia? What were your takeaways from Bangladesh, and how did it change your views in Australia?
That's a really good question. It changed them significantly. I think that it changed me as a person the first time I went there, and that's why I think it's really amazing when we think about people like Salek, who that's Salek's country, that he's experiencing this on a daily basis, and he chooses to work in that context, in that setting. So I was there for a few weeks and then a few months, but it's nothing compared to the people that are living there day in, day out. And I think that the more we can raise their voices, the better as well, which is why it's so, for me, really, it's really exciting to be here with Salek, and to let Salek talk. So I should shut up and let Salek talk. But it did change my view coming back to Australia. It made me realize how lucky we are here, and how people live in really challenging situations but still have this incredible amount of resilience. So it just kind of motivated me to want to do more if we can in those contexts. I think we've all got something to contribute, and we can.
Yeah, amazing. Thank you.
Thank you, Simon, for your answer. This is really good. And if we be slowly approaching towards the end of an hour of interesting conversations, then something that you put out, and because now, Simon, you put your thing, but Salek, I was wondering, what would you say we can learn in the world now from your experiences, be it working with vulnerable people, working with physical activity? If we look upon future healthcare professionals, so what we talk about now, what kind of advice would you give them if anything was possible? Or in what would you say from, please focus on this, or can you give us an advice?
Okay, so in my view, actually, we need to work as an integrated team, actually, to know the person's well-being from the different angles, actually. So because the mental health is not only the depends on the only one thing. So it depends on the many issues actually. So that's why we need to work with in a coordinated way. So the healthcare professionals also think about it. So for example, we also face some difficulties with when we started our career with the doctors actually. So they only focus on the physical health. They didn't mention the mental health. So they separated it actually. Uh, but now we are trying to build a good relationship with them and also providing some information that some problem can be mental health which can be turned to the physical health. And I have also the experience to work in the Apollo hospital, so I see that some stress can change the bone and the structure, the physical. So I have this practical experience, and I also suggest them actually to work on these issues. So we also found some positive response from the different health colleagues who are from the medical background. Like now the coordination is more improved compared to the when we started our career. So for any health professionals, we need to think in a holistic way actually, not to just only focus on one things. If you really want to improve the mental health and psychosocial well-being, you need to work from 360-degree angles. So sometimes it is really difficult to coordinate and to get suggestions from the other, but we need to actually push on it. So this is my actually feelings actually, what I feel so when I going to work with the others. Yeah. Though it's a challenging, but we need to keep on it, continue it.
Oh, thank you. This is to say also it's holistic, and so it's not by looking upon the parts, it's the whole person. It's not only the person, but also here you say it's different professions, but it's also the community. So there's completely interacting elements who are constantly into each other, which you have to take the whole picture. And at the same time, what I hear from you, look upon the barriers that exist. There are barriers and there are limitations or there are constraints. Maybe it's more challenges that we walk upon. But I also hear you say openness and hope, respect with each other to work with. The other part, what I heard you say, so both from the work from you and from Simon in Western Europe, which is the thing that we know most, it's very individualized. So it looked like every person with a mental problem, there's a mental health care professional who will serve it, something like one-on-one.
Yeah.
But at the same thing, what I hear from you, although maybe that would be preferable, I think that the social part what you created in mental health may have a much bigger influence and sustainable also when you said in the beginning self-care. So that's the thing that we didn't reach so much of provide. It's not only curation, but it's also creating this sense of self-care, so community building, the social element. Can you maybe talk a little bit about that one as well from your perspective, if you understand what I mean?
Yeah, it's you want to talk about the self-care or?
Yeah. So I think that is this kind of self-care and building it up from into a community. So it's not an individual element, but I hear from you, if I'm correctly, it's also something you build up self-care with each other. So it's in an interaction element.
Yeah. So, for example, on behalf of the agency level, so we actually did a lot of things from the organizationals who have a very low capacity, some national and local agencies. So we advocacy for those things actually for the self-care, not only for the beneficiary, also for the who are the first responder or who are the providing the supports. So we advocacy for these issues. And community level, we also do some awareness session with the community people. So we also inbuilt the self-care is inbuilt in their sessions. And we also like one intervention is very uh, innovative, like in the refugee context, like the mental health and tea stall. So we created taking the initiative actually to do it, because already I mentioned that the men are actually having the nothing to do in the camps because they have no job and they have no. So most of the man is spending time in the tea stall. So that's why our session is go to the tea stalls to discuss with the man, and some ideas also come with the like this. For example, in our sports, we find some referee for the football match from those session actually. So it is connected actually. So through this way, we are trying to build some things. And another thing I would like to mention that through different organizations are building the community center in the each camp has there are 34 camps in the Wijchen and the Teknafu Jela of Bangladesh with a very limited area. So in 34 camps, there is 34 community center actually. Though it is very limited, but in the community centers, they can come, they can collect the informations, they can learn what they want, and they can share what these things. So in these sessions, we add this self-care actually. Did I answer you?
Yes, definitely. This kind of, yeah, it really helps me to get my head around it. Is there, Maria?
Short question. I was thinking about the role. It's a follow-up of what you asked about social effects of this, because we have it, as I see it, not only in camps but also in other countries. There's a huge challenge now with political radicalization and political polarization. And I was just thinking on the following thought there, to how to have tools for working with this, and if then sports is one such tool that we can use in camps and in all societies to build more bridges and understanding between can I say between cultures or just between people, and what do you think about that?
I would just add, it's also a possibility to create meaning, create opportunity, create purpose for people who otherwise wouldn't have any. If you think about, young men, there's an ability to offer coaching roles, to offer, roles supporting other people engaging in activity. So that potentially offers an alternative to some of those negative things and those negative behaviors that Salek mentioned earlier as well.
We have an example here that there's a sports club who, those that are kicked out of the other sports club because they make a fuss, they are invited into that sports club and they ask exactly what they do, exactly what you say now. They give them meaning and roles and leading others. So
that sounds great.
Yeah, it's I think we can use your experience in everywhere, to be honest.
Definitely, and I think that this is something that we definitely can do. Use the experience of sports and physical activity, especially when you look upon that both Salek and Simon, you mentioned also sport not so much as a competition or concurrence. It's more like a way of dealing and working with each other. And in engagement is a social enterprise to go with. And I think this, what we just heard about your story, it's the capacity building with each other. So within the community that brings it forward. So that also brings the allied health professional from all kind of elements, from the individual level to the social level, and how we can together build and co-create a social level. I really want to thank you so much for this conversation, Salek. Thank you so much for sharing your thoughts and experience, and Simon as well, Maria, Max, Hanneke, Robin, Samantha. Actually, I just hope that this is just the first time that we meet in this way, and because now it's more kind of a time to start reflecting, and I hope it's okay when we reach out again in the near future to dive even more deeper into the experiences. And whenever we can collaborate in any way, please reach out. Thank you very much, and we get in touch.
Thanks for having us, Joost.
Yeah, big applause for Simon and Salek.